Success for me is really just first and foremost that I'm adding value. And that can be in my personal life or in my professional life. With my children, when I spend time with my children, even from the time that they were little, I would turn the radio off in the car. When I had my kids captive in the car, I wanted to talk to them. I wanted that to be valuable time and not just a waste of time. So it's value. I always want to have value add. And in the professional space, it's if I'm coming and working with a client, it better be a value add or you don't need me, right? So I'm very much about value, and when I feel as though I'm adding value in others people's lives, then I'm successful.
Welcome to B2P, B2B Business and Podcasting, the ultimate podcast for B2B business owners who want to grow their brand, expand their reach, and generate more leads. Join myself, CEO of Momish Mavericks, Maynard, as I interview top industry leaders, share best business practices, and explore innovative techniques to integrate into your overall B2B marketing strategy. Hey there, everybody. Welcome to B2Pod Podcast. Really grateful for all of you to come and join in with us. Today we have a very great guest. We have Jerri Ivey. Jerri is the owner and CEO of Spark Healthcare Consulting. Thanks for joining us today, Jerri.
Thank you for having me.
Yeah, the pleasure is all mine. Really grateful to have you. Today basically we're talking about your journey, which it's really great, serendipitously into what you're doing right now. But, the meat and potatoes basically is going to be about the importance of actionable data, the results a provider can expect through an internal EM audit. So great, I get to learn about stuff that I have no idea about, which is amazing, and how your billing team can optimize technology to improve collections. So a lot of great stuff. Everybody should stick around to the end to hear all this amazing things. And but as I always say, we'll start it off early. We'll start off easy today. Let our listeners know where you're based out of today.
Out of St. George, Utah, southern Utah.
St. George, Utah. Wow, Utah. My relationship with Utah is just beauty. Honestly, my aunt lives there in Utah, and I've only been a few times. But every time I've been there, I'm just like, how is not? I'm just surprised that you guys able to keep this a secret, and so many people aren't just flooding you. I'm from LA, the place of transplants. You would think that, but maybe you guys are weird about that. Maybe we should keep that on the low, kind of thing.
Keep it on the down low, yes.
Yeah, exactly. But so Utah. So tell me about your journey, right? Tell me about kind of your journey. You've been in consulting, you've been in healthcare, you've been doing a lot of things for a long time. So, tell me everything that kind of led to Spark Health Consulting.
Yeah. So I've been in healthcare for over 35 years, primarily on the revenue cycle side. And people ask, well, what is that? What's revenue cycle? And revenue cycle is really like when you go to the doctor or the hospital and they see you and they send you a bill. That entire process from literally the time that you call and make the appointment until the time that the charges are paid for is called the revenue cycle management process. So it's the business side of healthcare, and that's really kind of where my heart and soul has been.
Better than collections. No, I'm just kidding.
Yes, it does. A little softer.
Yeah, exactly. No, sorry to interrupt. Keep going.
Yeah, no, that's good. I've worked in the private sector, working for healthcare organizations all over. I've traveled to different places and lived in different places. And I actually took 10 years out of my revenue cycle career when the electronic health records started emerging, and practices had to go from paper to electronic. And so I did 10 years of consulting where I went in and helped these groups move from paper charts to electronic charts and doing all their billing that way. And that really gave me a really good flavor for consulting. I loved it because I got the opportunity to go to clients all over from New York to New Mexico to California, and actually experience those areas as well as get to meet great organizations. And I think I've shared with you, not only when a consultant comes in, do we get to come in and help them either with a project or a task that they're working on, but a lot of times we learn best practices from them as well. So every healthcare organization out there has something that they're doing great, if not many things that they're doing great. And so it's great to be able to take those and be able to share those with other groups as you move forward.
I love that. I mean,
So,
yeah, I think that that was something that really sticks out to me because I think sometimes we think about consulting like everything's a mess, come fix it,
yeah.
or like this part's a mess, and it's like, well, listen, this part may be a mess, but not the whole system isn't broken. This is actually really nice what you're doing here. I haven't seen anybody do this before, and you get to like
Yeah.
pick that up and now like make that part of like is an ingredient in your recipe, and maybe it doesn't work for this company, but maybe over here you can integrate that, and it's fantastic,
Hmm.
right? I mean, I think that that's one of the things that companies really miss is you want to create a culture, you want to create, a system, and you optimize it as much as possible. But ultimately, a lot of times it's an internal, and people who are like sitting there looking at it, thinking about it, looking
Hmm.
at it, and oh, this problem arises, and you try and like put some duct tape on it and fix it. And, like now it's fixed, but you're like really haven't gone to like the crux of what's actually going on in here. And I think that that's
Hmm.
really the importance of having a consultant. Now, tell me,
Hmm.
so there you are, you're doing consulting work, and now it's with Spark Health. I guess how are you helping people there that may be different from what you're doing before, and now as an independent consultant?
Yeah, so great question. So EHRs are now implemented. They're done. They're by the wayside. People are optimizing them. They're making them better. But really, after I left the consulting business, I went back into revenue cycle, and I actually took a year and did private consulting where I just did it myself and worked directly with a hospital over in Guam. And for a year, did a 1 year contract and really helped them set up really just kind of the revenue side of things and being able to, again, understand the business side of healthcare.
Mm-hmm.
And it was a hospital that was owned by a Philippine company operating in a U.S. territory. So a lot of the U.S. things that we do are a little foreign to them. And so being able to come in and kind of help train on that. And that really, again, showed me, wow, consulting obviously is vast. You can do so many different things, especially in the healthcare space. But when I came back stateside, I went to work for a startup company. Loved that. It was a great opportunity. Learned how to set things up right the first time, which was something in my career that was fun because a lot of times I was brought in to clean things up versus
Mm-hmm.
now I get to set it up right the first time and we get to do it, the right way instead of have to come in and correct things. But honestly, I kind of hit a point in my career and I had started actually gotten a couple of referrals to do some side consulting assignments. And I think it was early this year or end of last year, my husband and I got talking and said, we just need to do this as a business. Let's
Mm-hmm.
just do it, right? It's really kind of being able to take and make sure that providers are getting what's owed them, and making sure that their performance, their financial performance is where it needs to be in order to be able to keep them sustainable.
Yeah,
I know
that's
everybody thinks
amazing.
that healthcare is like easy noodles and doctors are just rolling in cash, but they're not. They
It's
have to
it's
work for
so
that.
crazy. It's so crazy because I have family members who are doctors, and I was going to be a doctor. I got into medical school, and I have friends who are doctors, and they're like, "Listen, what it was for your grandfather and your uncle, it's not what it's going on now.
Mm-mm,
With
mm-mm,
insurance malpractice suits, all these kind of things,
mm-hmm,
and that's just the tip of the iceberg. And that's you mentioned about the business of healthcare, and I think that that's something that people, most a lot of doctors, I don't want to generalize, but a lot of
mm-mm,
doctors are not business people.
no.
They could be brilliant. Doesn't mean that they're
Mm-hmm,
even nice people. Doesn't mean that they have a good health. Whatever.
mm-hmm,
It's not a blanket thing either way. But many of them are not entrepreneurial minded. They're not business
mm-mm,
minded, and that's why they have to have people around them that are. And you mentioned kind of like that startup and working for a startup and how that was like, oh, that's cool, but it kind of like led to now being able to, you saw the light and you're like,
mm-hmm.
wow, we can do our own thing. And I think that that's going to be the best. And I guess, with startups, one of the things that I think is overtaken a lot of is like data. It's like data, big data. This is like the, one of the big buzzwords. But, so tell me about the importance of actionable data and why really this needs to be integrated for any kind of healthcare system and what people are doing.
A great question. So there are so many reports and so many ways that you can slice and dice information, basically out of the business side again of your healthcare. And unless it's data that's actually going to give you something that you can act upon, the data is just informational, right? So we do have informational data that we look at on a monthly basis from practice to practice. It's really just stuff for them to watch trends, right? And then when they see a trend that maybe dipping, let's talk about charges, right? So like if a provider's charges and you're looking and trending it month over month, that's informational data. I'm just looking at that information from month to month. I'm looking to see, does it go in down, low, up, high? Sometimes providers, depending on their specialty, they're going to have times where they're busier, like their peak season. If you're a trauma surgeon right now in the summertime is their peak season, right? Like everybody's out, they're active, they're doing things and they're getting hurt.
I never
And
thought about
so,
that, but yeah, for sure. No one's running around and blowing stuff up in the snow. It's just not happening.
no,
So.
they're really not. So, providers, depending on their specialty, have peak seasons. And so a lot of times too, your trends will mimic that, right? When you see your charges go up and down. And so that's informational data, but actionable data is like when we're looking at information, and one of the key performance indicators and KPIs are what we drive a lot of our stuff off of in healthcare. When we look at a key performance indicator like denial rates, right? So how many claims, when we submit a claim to a payer, does it get denied? What's the percentage of those claims? So we take the total number of claims divided by the total number of denials. There's your denial percentage. That denial percentage, there is a KPI for that, right? So it's informational. But if that KPI is greater, I mean, if your number is greater than that KPI, then that's something you need to start looking at, right? That's where we start leading and diving into the root cause. Root causes are typically where we can have actionable data. We go in and we look at the specific types of denials. What are the types of denials? What are the reasons why we're getting claims denied? And then we have actionable data. We say, you know what, we're making mistakes on registering our patient up front. We're not getting the right insurance company. We're not entering in the right diagnosis code. Whatever the reason for the denial, we can now categorize those and act upon those to make changes so that the claim doesn't get denied and it can get paid on the first submission.
Wow, and I think that that's such a informational data, something that's like cool, yeah, that's things are happening, right? But what are we going to do about it, right? How can we actually, and I think, people get so obsessed with data and KPIs that we sometimes forget, we get lost in the sauce a little bit, right? We kind of get lost in the forest and we make them all kind of equivalent and it's like, wait a minute, no. First, that has no bearing on revenue and that has no bearing, and there's nothing really we can do about it. Here's actionable data. Here's something that we can go and we can put into practice, right? And and it's interesting as well, you in terms of the revenue cycle and all these kind of actionable data and the revenue cycle you mentioned there, that it's from the time where you bill and you get the bill back, right? And then you mentioned the how there's peak seasons for certain doctors and during the summer for trauma. And that's what I actually thought, like, the revenue cycle must have been. It must be like, how are things throughout the year, sometimes up, sometimes down. I didn't realize, right? So this just goes to show that I didn't know much about the revenue cycle. Another thing that I don't know much about is EM audit. Another thing I don't know much about is EM audit, right? So tell me what an EM audit is and tell me why, those results would be important to a provider and what they can expect through an internal EM audit.
Yeah, so E&M stands for Evaluation and Management. And so, again, this is the crazy part of business and healthcare, is that for every type of visit that you go to the doctor, there is what we call a correct procedural code. It's a CPT code. So there's a code that they use to say, this is what you need to bill for this patient. And E&M is Evaluation and Management. And when you go to just your general doctor, family medicine doctor, and see them, there's different factors that go into that Evaluation and Management code as to which level, right? So there's typically 4 levels. There's 5 out there, but really only 4 that they bill. for either whether you're established or you're a new patient, right? So if I'm a new patient and I'm coming in, I could hit one of those 4 levels. And as you can expect, each of those 4 levels have a different dollar value, right? So the higher the level, the higher the dollar value that they get reimbursed for it, right? Well, evaluation and management codes then obviously get billed out to the insurance company and they get paid. And the evaluation and management audit, an E&M audit, is where we come in and we look at the documentation. We verify that the code that was billed is the appropriate code. If it is not, then we report back to them, we report why, right? So the problems addressed is one of the components that go into it. The information that's being reviewed and or ordered results, tests that are being ordered, or if, let's say, a surgery is being suggested, right? You go into a surgeon and they say, yeah, we need to do surgery for this, right? That's one of the factors, the medical decision making. Those are all things that go into it. And when we look at the documentation, we take into account all those factors, come out with a code and say, this is where you're at. Now, the reason why that's important is because Medicare, who is really governs, CMS is a lot of things we govern things off of, how Medicare bills and pays and what their guidelines are. And so the Office of Inspector General is actually another governmental body who does audits, right? So OIG is what we call them. OIG will actually look at a payer's practices. I said that wrong. Practices the way that they bill things out, and they look at that and they trend it out, and they do what they call a bell curve for the E&M codes. So a bell curve depending on your specialty will peak at different parts at those codes. Well, if they see a provider who's out of whack on their bell curve, maybe they're billing a really high number of those high codes, and they're saying that's not normal for that specialty, they may come in and do an audit. If OIG comes in and does an audit, you're going to have penalties, you're going to have fines, you're at a high risk. You're at a very high risk. You don't want to be at a high risk, right? So, and I always say that's not the reason to do audits. It's one of the reasons to do audits. The other reasons to do audits, and I see this happen a lot, providers are undercoding because they're so worried about those audits coming in and getting fines, and they're worried about that happening. Well, undercoding is actually just as serious as overcoding something. And so, and you're losing revenue. Like you're seeing a patient, you should get paid for the services in which you performed and not less or more than, right? You should just get paid for that. So instead of undercoding, let's just build the appropriate code and let's do some education along why you may have been undercoding and just educate providers.
Wow. Yeah. I mean, definitely better to have an internal audit than an external audit. But I'm surprised that, initially I was like, how is it possible that people are getting billed to incorrect codes so often? I mean, you mentioned half of it in terms of, undercoding. People are kind of like, I don't want to get on it. It's better to be on, but you're like, this just as bad as overcoding. I mean, how does that overcoding happen, or is it human error? And is there anything, to be able to do about that? Is that basically what it is, or?
It is, and a lot of times it is tough. I mean, even as an auditor, I look at these sometimes and I'm like, wow, I can see why the provider maybe coded it at that level, but maybe they're missing something, right? So one of the things that sometimes they may be missing is in their documentation, if they base a code off of, like, let's take, for example, the highest code, a 99215. Established patient comes in and you're visiting with this patient and they're going to have surgery, and you're talking with them and their family for an hour and a half and answering their questions, right? Maybe the patient got diagnosed with cancer recently. That hour and a half, that 99215, only covers up to 74 minutes. It doesn't cover up to maybe a full hour and a half, a full 90 minutes. Well, you need to be able to document the time that you spent with the patient, right? So even all of your other components that you have that go into that E&M code may not meet that level 5, but the minute you document that you spent an hour and a half, you now are at that 99215 code. And all they missed in their documentation was that time that they spent. So a lot of times it's just education. It's not because anybody's like trying to be fraudulent or they're trying to, do something they shouldn't do.
You
A lot of
hope
times it's
not.
just
I
that,
mean,
no,
you'd hope it maybe happens sometimes, but you would hope it's not an industry-wide. You
right.
mentioned that overcoding, undercoding is an industry-wide kind of problem that you constantly. I would hope that it's not for that reason, you know. So yeah, I mean, it
No.
makes sense.
Yeah, a
Yeah,
lot of times it's just missing documentation. And so it's how do we make your documentation better? And, a lot of times again, they get busy and they forget. And so they have to just be reminded every once in a while as a
yeah.
provider that these are the pieces that are important to make sure that I document. And when you said your family members said, hey, it's different doing medicine today than it was like for grandpa, you know what? They didn't ever have to take into account all those things. They
Yeah,
didn't even have to do very, very good with their documentation. They could do
yeah,
chicken scratch on a little piece of paper that said that a date, and that was it. That's all it was required.
yeah.
Things have changed so much in the
Wow.
last 30 years.
You're telling me the old adage of doctors having bad handwriting is changing too? That's wild. You know, they gotta like, this is what it is. And yeah, talking about human error and kind of things changing in terms of that billing, right? I mean, with human error and education, I think, and you
Hmm.
mentioned about things changing and the time changing. One of the things that also changes consistently is technology. And
Yeah.
technology can be really helpful or it can be really not helpful or people think over rely on it, I guess, right? So I guess tell me
Hmm.
about how like optimizing technology today can really, improve the collections for billing teams out there.
Yeah, so if we just take a step back and look at the documentation that we were just talking about, right? Within electronic health records, there are templates that can be built and designed and all that type of stuff. And if practices haven't taken advantage of building those templates and taking that time to invest into it so that they can improve their documentation, right? That means their documentation is not going to be maybe meeting the level in which it needs to be. The other areas is right now I'm a billing office. I send out all of those claims to the insurance companies. Now I have to make sure they pay us, right? So one of the best uses for technology these days is most practice management systems, which is the computer system that they use in the practice to bill things out and post payments, have fee schedules in the system so that you can, by payer, load in those fee schedules. Now, what this means is you have to know their contracts. I have to know all of my contracts. So every single insurance company, Aetna, Cigna, Blue Cross, Humana, all of those, you have a direct contract with that insurance company to pay
Mhm.
you X number of dollars for whatever it happens, however they do the calculation, right? Either by CPT or by relative value unit. You need to know that. So you need to look at your contracts. You need to know that information. You need to know what that fee schedule is and how much they should be paying you, because just like any other technology flubs, their system may not be loaded with the right fee schedule and they could be underpaying you,
Mhm.
right? So you may not be getting paid what you agreed to with that insurance company. So once you go through that process, you get your fee schedules and you load them into their system. Now you can actually, again, have actionable data. You can say, this is what they allowed or they paid us, and this is what our contract says. Well, they're paying us less than what they're supposed to be paying us. So we need to go back and ask them for the additional money. And then usually they figure out what the problem is. They go in and fix their computer system and they start paying you correctly going forward. But you
Wow.
don't want to leave money on the table because again,
Yeah.
it's you're fighting for every dollar.
No, I mean, and like you said, I mean, everything's changing. The economy is changing, healthcare is changing, and talking about, you and your husband deciding, hey, you should go into this and go full steam, I guess, obviously. And, we're talking about healthcare providers billing their, patients and everything going on there. And I
Hmm.
guess, doing what you're doing, having a business, right? The most important thing is also being able to have clients to be able to bill and having
Yeah.
having your own revenue cycle going on there and that stuff, right? So I
Yep.
guess in that regard, you know uh, what's like the biggest challenge that you're facing right now in terms of bringing new business and everything, and or maybe what have you done to get that going now in kind of your earlier stages of the business?
Yeah, so we've really been focused on Spark getting the foundational pieces, right? This is kind of those lessons learned in starting a startup is let's make sure we have those foundational pieces in place, right? One of the things that I've always been felt was very important is making sure that we have the credentials and the credibility as a company when you go out there in the marketplace, right? I want people to understand that we're not just a pop-up mom and pop shop. We're not just, we actually have, I've got the experience, the network, the credentials, I've got the alphabet soup behind my name to be able to get this done, right? But I want it obviously to look official. And so we've been spending a lot of time in that. I've got two really great and incredible clients that I've been working with for the last 9 months. And, referrals from them is where I'm hoping as well. I've actually been working with other companies, even with them. So I have a client in New Mexico, and they have two other, like a billing company and a consultant that they're working with, and they're both going to send me referrals. Again, networking, I think, is probably one of my biggest, obviously, referral sources. For me, that feels natural. That's the easy part, right? Setting up to go to conferences. There's a HealthCon conference that's happening in April in Florida next year, and I'm hoping to go to that and get to visit with people. I'm a more of a soft salesperson than a hard salesperson. I'm not going to be the one that's probably going to call you and say, hey, look, you need my services, right? But I'm probably going to grow organically off of referrals and really by word of mouth. And by, again, I've been in the industry for 35 years. I've made a lot of contacts out there.
Yeah, and for sure. And, soft sales, I think soft sales are about relationships. And that's the main thing is building relationships, not like, hey, you need, like you said, right? But having a system to build relationships. And obviously you've been there for a long time doing it, and like you said, right? You've been doing this for so long. It's easy to see, but as we mentioned, unfortunately, perception kind of leads before people so having, as you mentioned, having that foundational basis and being able to show that credibility that coincides with the insides, or with that experience, as I sometimes say, with e-commerce and stuff, it's like, it's easier to sell a bad product in a really nice package, marketed, branded well, than it is to sell a great product that doesn't look as good, and that's unfortunate sometimes, but definitely, as you mentioned, the networking, the communication, the relationships. To me, it's like relationships are number one. They always are, and and that way, it's things happen for sure. So I love that. I guess is there anything else exciting? I know we're kind of in the earliest stages. Anything else exciting that you want to share with our audience today?
I think probably one of the funnest things that we have done as we've launched the company is, and I wish I had him here with me, but you can go out and actually look for the Sony Ibo dog. And we actually have one of the little robot dogs, and he is our representative of the company. You can look on LinkedIn. We post videos as he learns new tricks and different things, but he's been a big part of us launching the company as well. And they're adorable. They're cute little dogs. I've now got my granddaughter hooked on watching the videos online because she just loves these little robot dogs. But, I think just being able to incorporate something like that that we can use as a marketing tool or that's a little bit of fun and can put some smiles on people's faces and know that, again, we're about relationships. We're not just about the business. And we do have a soft side and his name is Spark. The dog's name is Spark.
Yeah, that's great.
He actually, a couple of weeks ago, I went on a client site visit for a couple of days, and he went with me and got to meet everybody and got to take a picture with the team. And so that's one of the fun things that we've been doing as well with launching the company.
I love it. The combination, I'm starting to see now the connection, Spark, robot, and what can I say, so it's all amazing stuff there. I guess, how can our listeners find out more about you, about Spark Healthcare Consulting, and get in contact with you and seek out your services?
Yeah, so I appreciate that. Obviously, you can find me on LinkedIn, Jerri Ivey, or Spark Healthcare Consulting's on LinkedIn as well. Our website will be up here in the next probably a week from tomorrow.
Yay.
Our website will be officially live on August 30th. And so sparkhealthcareconsulting.com is out there as well. So there is a way you can look at all of our services, what we offer, as well as there is a contact form in there where you can reach out to us.
Wow, that's incredible. Yeah, and by the time this comes out, it will be out. So all those links will be there here in the description. So seek out Jerri. You can find her very easily by just clicking here on the description and be able to find her. And I guess, before I let you go, I always ask everybody, and love to hear you, let others just know success means something different to everybody, right? So what does success look like for Jerri? What is your definition of success, whether physically, spiritually, with business, otherwise? Tell me what success looks like for you.
Success for me is really just first and foremost that I'm adding value. And that can be in my personal life or in my professional life. With my children, when I spend time with my children, even from the time that they were little, I would turn the radio off in the car. When I had my kids captive in the car, I wanted to talk to them. I wanted that to be valuable time and not just a waste of time. So it's value. I always want to have value add. And in the professional space, it's if I'm coming and working with a client, it better be a value add, or you don't need me, right? So I'm very much about value, and when I feel as though I'm adding value in others people's lives, then I'm successful. I also, for me, a lot of I'm getting older, and a lot of this is being able to have a family business is huge for me. To me, that is success, right? I've got a daughter who's also been in healthcare for, oh gosh, about 15 years, if not more now. And she's been on the business side of healthcare, so she kind of followed in mom's footsteps, and it's been fun to be able to work with her. She works for me as well. And so for me, that's success, right? I'm building something that I can hand down to my family.
I love that. I love that. And, obviously value, I mean, it's number one, right? If we're not helping people, if we're not providing something for other people, how can we expect anything, right? I think the world is a mirror. So we get out what we put in. So if I'm not creating value for, how can I expect for even a moment to get any value out of the world? And, and it's just the way it works. Some people, they're like, well, I'm not getting, yeah, what are we putting? First you put out, then things come, and that's the way that it is.
It's truly the law of attraction, right? You put out, whatever you put out is what you're going to get back. And I firmly 100%. Believe in the law of attraction. And I firmly believe that with a positive attitude and with, a positive direction and knowing that things are going to, just happen, that they do. And so, but like Tia said, it's what you also get back. It's what you get back from other people.
Yeah. And having that attitude is so important, and also having the skills to pull it out, and that's what you have, and the experience and the wherewithal. And I love too that your daughter is working with you. I'm a business owner, entrepreneur, because I grew up watching my dad doing it. So I get to have these kind of conversations with my dad, and watching him and following his footsteps, and it's kind of who I was anyways, but just kind of being around it, and I couldn't live any other life anyways, so I'm good for you for doing it for so long. I couldn't have waited for this, but in any case, right, I think that's so great, creating that legacy with your daughter, and having that, and I think that's fantastic. I think that's like, living the dream. So it's so great. Jerri, it's really great to have you on today. I really appreciate you, appreciate your time. And everybody, once again, seek out Jerri's services here with Spark Healthcare Consulting. And we'll continue this conversation sometime. And appreciate you, appreciate everybody wherever you're listening. And all the best to you and your family in this endeavor.
Thank you so much, Maynard. I appreciate it.
Thank you.